Hello, this is Bryan Rosner with Biomed Publishing Group. And because we're having such a strong winter now, it got me thinking about a very important topic, and that is the seasonal variations in Lyme disease. Now, when I say seasonal, I mean spring, summer, fall, winter, that type of season. And you basically have two things that happen. The first thing is actual differences in Lyme disease symptoms themselves. The second thing is differences in the way that your body responds to treatments during those seasons. Now, let's talk a little bit about the first subject. Lyme disease bacteria have quite a mysterious timetable, and they actually have different behaviors and different activities depending on the season. Now, most other types of bacteria, not Lyme disease bacteria, like strep or other types of bacteria that might cause the flu, their life cycles are very short, maybe 3 seconds to 10 minutes. And that's why antibiotics can really wipe them out, because regular antibiotics will catch bacteria during their life cycle hundreds of times, because you take a 10-day course of antibiotics and the bacteria may have gone through their life cycle 10,000 times. So you've really caught them all, and that's why common antibiotics will cure most bronchitis and strep throat and that type of thing. Lyme disease bacteria, although they do have a shorter life cycle that can be 3 to 30 days, certain types of Lyme disease bacteria also have very long life cycles. And so people tend to notice flare-ups during full moons. They often tend to notice flare-ups during different seasons, especially spring and fall. And this is very important for you to know, because it can be very confusing if you don't know this. You might be going along just fine in January and February, and then in March, all of a sudden, you feel like crap, and if you don't understand these principles, you're going to be pretty much left out in the dark. Whereas if you do understand these principles, you might be a lot better equipped to deal with what's happening in your body. Now, the second subject is how your body responds to treatment during different seasons. And this is quite possibly one of the most important messages that I have for you. And the way it works is like this. Someone will be using their Rife machine maybe about once a week, and they're getting average Herxheimer reactions and average improvement. Nothing's really happening that's that significant. They're just plodding along in the recovery process, doing fine. Then all of a sudden, in maybe March or April or August or September, they'll do a Rife machine treatment and all hell will break loose. They'll have the biggest Herxheimer reaction they've ever had. Their symptoms will go out of control. They'll probably end up experiencing quite a bit of improvement in the long run, because they killed quite a bit of bacteria. But the most common misconception about what would happen, or about why this happens, is people say, wow, I must have done something different. That Rife machine treatment must have been special. I must have used a certain frequency, or I must have somehow figured out some insight into this bacteria that allowed me to really kill a lot of bacteria and get a good Herxheimer reaction and some good improvement afterwards. That's just not what happens. You can do an identical treatment and all of the circumstances can be completely identical. And what really changed was the life cycle of the bacteria. Since Rife machines only work during certain periods of Lyme disease life cycle activities, when you're in the wrong period of that life cycle, the machine doesn't really do anything. And since Lyme disease bacteria have such a slow life cycle, you might go 2, 3, 4 months without any action, and then all of a sudden the bacteria decide to wake up, start moving around, and start doing something. And next thing you know, you're in the midst of a huge Herxheimer reaction and probably some good improvement afterwards. And it's just important that you understand that this comes with the territory. It's based on what the bacteria are doing. It's not based on what you're doing. And it doesn't really matter if you're doing Rife machine treatments or anything else. The bacteria are basically going to keep going with their life cycle activities. And the real important point is that if you do Rife machine treatments, pretty consistently, then you're bound to catch the bacteria when they're in their life cycle activities, and you're bound to hit those points where you really accelerate the recovery process by taking out quite a bit of bacteria during the spring and fall months. So this is Bryan Rosner with Biomed Publishing Group, and I hope this little chat has helped you understand the complexity and the basically more than meets the eye principles that go on with Lyme disease treatment, and to really take a closer look at your treatment analysis and the conclusions you're making about your treatment, and make sure you're on the right track with those conclusions. If you want to learn more about my research, you can do so at lymebook.com, lymebook.com. Please remember also that I am a journalist, not a physician, and not a healthcare provider. So this video is for informational and educational purposes only. It's not for medical purposes, and it's not for medical advice. So thanks, and I hope you can enjoy the snow if you have snow where you are. I'm certainly trying to enjoy it, but it kind of gets to be a pain after a while.